For the elbow's ultrasound, we start scanning aiming at the study of the anterior compartment. We move laterally to study the tendons components of the lateral compartment of the elbow, through a medial compartment, and then we end up with the rear compartment. The front compartment requires scans that allow us to study some very important structures. We see, in particular, a tendinous structure represented by the distal tendon of the biceps that can be well displayed by axial scans at the level of the cubital region of the elbow. We recognize, as a first point of reference, this structure that represents the brachial artery, and we also recognize the distal tendon of the biceps outside of this structure on the short axis. Medially, at the tendon, we also find the radial median nerve. Now we will evaluate the tendon of the long head of the biceps in its full extent by executing scans along the short axis, moving distally up to the level of its insertion on the radial tuberosity. This tendon is not easy to see. We have to be very careful to correctly scan the whole surface. We try to evaluate also along the longitudinal axis by rotating the transducer counterclockwise by 90 degrees. The tendon is represented by the structure. With slight movements of the wrist, we try to make an optimal scanning. This is its longitudinal extension. Other important structures to be studied in this region are represented by peripheral nerve components. We know that ultrasounds are very valuable in the study of the peripheral nerves. We see how with these scans we can study a very important nerve as a radial nerve in its branches up to the level of the arch of Froese. In this scan, we recognize the radial nerve, and we follow it with an axial scan up to the level of the cubital region. Here, it divides into two branches, one represented by the infraosseous posterior nerve, and the other is represented by the sensory subcutaneous nerve. This division is at the level of the arch of Froese. We recognize here the arch of Froese and the two nerve components, one the infraosseous posterior nerve and the other the sensory subcutaneous nerve, with the form of these two small hyperechoic structures. We can now go back to examine another very important structure, always doing scans around the cubital area. This is the median nerve, which, as you know, runs medially to the brachial artery. We recognize the artery by its pulse and by the movement which is created by exerting pressure with the transducer. The median nerve starts medially. We can see it very well here. Its characteristic feature is to be characterized by hyperechoic components with small hyperechoic areas in its context. We see it in all of its extension. We now move to the lateral compartment of the elbow by inviting the patient to make a slight movement of internal rotation. We examine a very important tendon system as the conjoined tendon of the extensors. The scan is very simple. We put the transducer on the long axis and we identify the tendon insertional component, which is represented very well by this hyperechoic layer. The common extensor tendon is very well shown because here it fits into the lateral epicondyle. We have to perform this type of scan in short axis to also see the tendons along the short axis component. We now move medially to scan and analyze the conjoined tendon of the flexor, which is very similar to what we did for the extensor tendon. We always start with a scan on the long axis of this part of the tendon. This is the arrival of the conjoined tendon of the flexor at the level of the medial epicondyle of the elbow. The insertion is very well represented. In this case, it is important to scan the tendon component also on the short axis. We move to analyze the posterior region of the elbow to study other two very important structures. The first is the tendon of the triceps brachii, and the second is the ulnar nerve. The position has to give the patient a very particular torsion. In this position, we can see perfectly the arm and the insertion of the tendon of the triceps brachii. Here we do a longitudinal scan, which allows us to see the belly of the muscle and the tendon that inserts in the olecranon. Also, in this case, as in all tendon structures, we do a study by rotating the transducer on the short axis, and we follow the tendon up to its insertion. This position is also very useful to study a very important nerve structure of the elbow, which is the ulnar nerve. We know that in this region, the nerve begins at the level of the epitrochleo-oleocranic casing of the cubital tunnel. We perform a targeted scan just to study the structure. We begin with a scan which is more proximal and move along the arm before reaching the epitrochleo-oleocranic region. This scan allows us to see very well into the epitrochleo-oleocranic casing, and it allows us to view the ulnar nerve in its rounded seat close to the bone component. Distally, the nerve goes into the cubital tunnel. It is very well visible on the screen. Here, at the cubital tunnel, we recognize the humeral and radial components of the flexor carpi ulnaris. We also scan along the long axis of the nerve, that is represented by this structure, well highlighted by the ultrasonography. This is the end of the ultrasound scan of the elbow. Thank you for your attention.